When I found out I was nominated or shortlisted in the nominations, I was actually a wee bit embarrassed because I don't think what I've done is anything particularly out of the ordinary, but I'm sure everybody says that works for the NHS. And to actually win it, when I found out how many nominees there were in that category, I was really pleased.
I think the Chairman's Award is for something maybe that doesn't fit into any other category and kind of shows the public face of the NHS. And I suppose part of that has been that I probably do go the extra mile, or my patients will tell me that I go the extra mile for them in whatever their problems have been, and nurturing them through that problem and keeping them going. So I suppose I got the award because of that. You know, and I'm sure it's not just me. So I feel as if there is so many people, so many good people working out in the NHS that go the extra mile. And I was just really honoured that a lot of my mums got together and nominated me for an award.
We were nominated and won the Contribution to Care Award, which was really personal to all the staff. It meant a lot to us that, you know, not only colleagues but patients and relatives were recognising, you know, the hard work that we try to do on a daily basis to provide the best service we possibly can.
It means a lot to the ward and to individual nurses to show that our care really matters, and it stands out.
We got the award for innovation in the staff awards.
When I saw the categories, I was absolutely delighted to see that there was a few mental health services nominated, because I do think that mental health services do get forgotten about at times, and it's good to sort of raise that awareness of mental health and how we can help to improve patients' experiences when they have a mental health problem and come into hospital.
I really enjoy working with, in particular, younger members of staff, and giving them some insight into how we can change practice. You know, the traditional practice, which works in a lot of circumstances, but we need to take a different approach within mental health. So it's a much more patient involved and patient focused intervention, and it's sometimes a new way of working for some of our younger members of staff, but they really take it on board, and when they start seeing results with people, they seem to find that inspiring, and it drives them on.
I am part of the choir, and we won the Volunteers Award. The choir was amazed when we won the award. We weren't expecting to win the award. We got nominated and we're pleased at being nominated.
When we won the award, I was just delighted. I thought that was amazing, and I think it's a real testament to the work that has gone into the choir and the amount of time that people have set aside to do something which does take a lot of work in terms of organising things, but which is really beneficial and has helped a lot of people.
What we do is, after our work on a Thursday evening, any of the nurses who want to come along and we take part in a choir. It's a fantastic thing to do together. It really relaxes us after a hard day's work, makes you feel so happy, and when we leave our choir in the evening, we're singing going down the stairs, walking down the corridor. We're so happy, just full of all these wonderful endorphins that just make you feel good. So to have won it was just fabulous, absolutely fabulous, the icing on a cake.